Well, tell me about what you experienced prior to us seeing you. We had some hip pain, we had some weight issues. Tell me about what your life was like before we started working on you here.
Hip pain.
Hip pain?
Lower back pain.
So how bad, on a scale of 0 to 10, how bad was the fatigue, 10 being the worst fatigue you could experience?
8 and 9.
8 and 9. And so how bad was the hip pain on the scale of 0 to 10?
9 and 10.
9 and 10. And the surgeon said something about your hip pain. What did they say about that?
Said I needed surgery.
And the diagnosis for your hip pain was what? What did they tell you that you had?
The congenital arthritis.
Congenital arthritis.
Yeah.
And so they were going to do what for that? They were just going to go in there and clean that up?
Right.
Okay. And so you started the program. It looked a little daunting to get into it, but after you got into it, how did you feel? After 5 days, how did you feel?
Start feeling better.
Okay. Better in how? As far as your energy? Your
energy.
What? How much did your energy go up in 5 days?
Probably about 60%.
60% in 5 days.
Yeah.
And how much better is your hip pain now that you're supposed to have surgery for, correct?
Oh my, probably 80 to 90% better.
80 to 90% better. So do you think you need hip surgery right now?
No.
So with this whole program, what we're looking at is food being your medicine. Food can be good medicine, could be bad medicine. So we found out certain things that are bad medicine for you as far as food, right?
Right.
And so now that you've gotten into a different diet, is that hard for you to do now?
No, it's just routine now.
Right. You actually didn't know what asparagus tasted like before. Now you're really
that
kind
was
of
the best asparagus I ever had.
Now I have to pull you back off of asparagus.
Right.
All the stores are out of asparagus around here because of you.
Right.
Thank you very much.
You're welcome.
And how about, you had knee pain, right?
Yes, sir.
Okay. And how would you grade that knee pain when we first started on you?
8 and 9 some days.
Okay. And it's a what now?
Probably 3, 4.
3, 4. And did we do any kind of manipulation or joint work, anything like that?
Nope.
And so again, that's all these different organ systems failing inside of the body that create a lot, if not most, of your symptoms. And so just by changing how these different organ systems work, we can change your outcome as far as your weight and your pain issues and so forth. So how much, let's talk about your weight. How many inches have you lost so far?
Total 12.
12 inches.
Right.
Okay. And what time frame is a little bit over a month. Is that correct?
We started June 16th.
And the weight connected with that. How much weight have we lost in that time frame?
24.6 pounds.
24.6. Not just 44. It's 24.6 pounds. Okay, we can't forget the 0.6. Okay. What brain fog? Brain fog. You have trouble thinking clearly.
Right.
And you're not blonde, so that's we can kind of throw that out of the picture.
Right.
So as far as brain fog, how much better is your brain fog? Would you say percentage-wise?
Probably 80 to 90%.
Okay. Good. And so you've done the lipolite where we're trying to lose inches by this device that opens up the fat cell and dumps out the fatty contents, and the lymphatic system then picks that up and excretes it from the body. So we lose inches immediately. So was that a hard thing? Was it painful? Was it scary?
No, I slept.
You slept. You slept through this whole thing.
Right.
Wow. Okay. So you would say that's a pretty easy process to do.
Yes. Very, very easy.
So this is lipolite is our alternative to liposuction, and that's what you had was the lipolite. And so how effective was that for you percentage-wise as far as effectiveness?
Oh my gosh, 80 to 90, 100%.
How many inches did you lose the first time we did that?
2.
2 inches the first time. Okay.
2 at the H1 and 2 at the H2.
So you're pretty excited about that.
Yes, sir.
Because your whole lifestyle is now changed because of all this.
Yeah,
is that correct?
Definitely.
Good. Good. Very good. Anything else you want to add?
No. Just my life is a lot better now. I will say that. It's different.
Good. A good different?
Very good different.
Good. And we'll just continue to keep losing inches, keep losing pounds. The energy will keep going up, and the fatigue keep coming down, and sleep keeps getting better. Anything else that we want to add? Are we missing something here? Can't think of anything else.
No.
Okay.
All right. Thank
you.
you.
Thank you for spending some time with us, and we'll hopefully make a trip to Fredonia, the big city of Fredonia, one of these days.
All right. Thank you.